You know, there comes a time when we may need some type of physical therapy, whether it's from an injury or surgery or whatever, and you want to go to one of the best places you can, and that's Community Rehab Physical Therapy Center. There's a location in Gulfport, just east of the hospital on Community Road, right behind Cinemark, or where we are today in Diamond Head. Lizzie Milner, Doctor of Physical Therapy. How are you?
I'm good. How are you?
I'm very well, thank you. And there are a lot of different types of physical therapy that you can use, and again, it depends on the patient.
Absolutely. Dry needling is one of the techniques that we specialize here in Diamond Head. With dry needling, we use a thin filiform needle. It's used to penetrate the skin to help stimulate the underlying tissue, which may include myofascial trigger points, which are just taut bands within a muscle that may be hypersensitive and may be causing that patient pain.
Now, it goes in, I think you were going to add a couple of more in there.
Yes, absolutely.
And I know he didn't really feel any pain or anything, so there's really not a whole lot of pain that's involved in it.
Typically, it's not very painful at all. You might feel the little
stick,
the little needle stick, but other than that, you might feel a little dull, achy sensation. But a lot of times, most patients will walk out of here feeling great.
Now, how long do you leave these in there? Does it depend on what you're treating?
It depends on what we're treating. Typically, I'll put them in place, and you'll see today I'll hook it up to some electrical stimulation, and I'll let that run for about 10-15 minutes on each patient.
Oh, okay. Electrical stimulation? You hook
Yes,
something up to them, electrodes?
Yes, sir. So I'll use those clamps over there and hook them up to my needles and let it go on for a little bit.
And what can they expect after this? I mean, as far as the after effects.
So the after effects, they might have a little bit of muscle soreness. Drinking plenty of water afterward will help to decrease that. But, and then they should have some relief in their pain. And a lot of times it is long lasting.
I was going to ask my next question, how long does it last?
It typically lasts a good while. They may need to come back a few times, but usually it's one of those treatments where they feel great immediately following.
Well, there's another wonderful thing that they do that's very interesting that I find, and it's called cupping. And she's going to show you that next. Now, Lizzie, another treatment that y'all do is cupping. And what is cupping?
So cupping is a technique in which we use suction cups. We place them on certain areas of the body to help with pain relief and to help with tissue mobility. And so the suction creates a negative pressure wherein the tissue gets lifted and helps to bring blood flow to that area. And so as you can see, we can glide it across certain tight bands of muscle to help lift the tissue and to help promote tissue healing and improve pain. And so we can do a couple different techniques with this.
Does it hurt?
It may feel a little intense, but when cupping is done properly, it should not cause pain. You might find that there are going to be little welts, little areas of bruising, and that's actually a good thing. That's the interstitial debris that gets released.
That means it's working.
That means it's working, yes.
Now, what kind of different issues do you use when you do the cupping?
So really, you can treat almost any part of the body with cupping, anywhere where you might find muscle tightness or any type of movement restriction, because this helps to promote decreased pain. It helps to improve the range of motion in individuals with any type of functional limitation.
And how long does this usually last, the treatment?
The treatment can last for anywhere from 5 minutes up to 10-20 minutes, depending on the area and the size of the area that we're treating.
All right, that's another one of the great things that they use here at the Community Rehab Center, both in Diamond Head, where we are today, and also in Gulfport. Another big one that works wonders for everyone is called the Aquatic Therapy. Now, when it comes to aquatic therapy, they've got a great situation here as well. Jessica Johnson, physical therapy assistant.
Yes, sir.
How are you?
I'm good. How are you?
I'm well. Tell us the benefits of aquatic therapy.
There are many benefits to aquatic therapy. The buoyancy of the water unloads your body weight off your spine and your joints, allowing it's less physically demanding for you to get in the water and exercise. So a lot of patients that find that it's just too hard to exercise on land, we'll get them in the pool. We offer aquatic therapy twice a day, several days a week. Each session lasts about an hour. We instruct each patient in their own individualized home exercise program. And once they're independent in that, a lot of them choose to join the gym.
Oh, good.
So that's a benefit of coming here to Diamond Head, is you have that carryover. You can, once they've made progress in the pool, they can join the gym and keep up those exercises on their own.
Now, what kind of conditions do you treat with aquatic therapy? I mean, there's so many different things that you do as far as a physical therapist in so many different ways, but what about aquatic therapy?
Aquatic therapy is great for generalized weakness, difficulty walking, balance impairments. You can get patients in the pool. The resistance of the water, they can work on muscle mass, activity tolerance, and they just do it in a much easier environment.
It's a lot easier for them to do these exercises in the pool than on dry land, right?
Absolutely. And a lot of times, once they're strong enough in the pool, we'll start incorporating some land-based therapy so they get a full, well-rounded program where they're able to have an aquatic-based home exercise program and a land-based exercise program. So all their bases are covered. And
I guess they can just wear regular swimming trunks or, baby suits?
A lot of patients do, or they wear like the dry fit exercise clothes in the pool. Like I said, we have the lift chair, so patients that are too weak to use the stairs or rely on a wheelchair. We've also constructed a water walker out of PVC.
Yeah?
So we've had a few spinal cord injury patients that can't walk on land. You get them 75% unweighted, and they're just amazed that they're able to move and able to do things that they wouldn't be able to do on land.
And that probably is going to make their recovery a lot faster.
Absolutely.
When doing that.
We also do a lot of patients before surgery. So the doctor wants them to have therapy beforehand, get as strong as they can before undergoing surgery so the recovery is quicker. And then after surgery, whether it's joint replacements, spinal surgery, once they're cleared by the doctor, their incisions are healed, we'll get them in here and they'll be able to get back to doing what they love quicker, whether it's playing golf or tennis, or get them back on the court again. So.
Definitely. And what type, I mean, they do different types of exercises as we can see here.
Yes, so it's a combination of strengthening mobility. We do a lot of postural training, because if your posture is not good, then everything goes downhill from there. We'll do some gait training, balance. A lot of patients don't realize how hard they're working while they're in the pool.
Right.
They get out, they're like, an hour's up already? That was so easy. And then they get out, gravity comes back, which isn't nice. And they find that they really did something. They go home and take a nap. So.
Oh yeah, because it'll wear you out. I mean,
Absolutely.
if you just get in swimming, which is a great exercise within itself, I mean, you work so many different muscles in the body.
Absolutely. And then we find patients too that are having a poor tolerance to land-based therapy. We'll refer them over to the pool. They don't want to go back. They want to stay in the pool. It's much easier to work over here.
So if someone is a pain in the neck to you, get to the Community Rehab Physical Therapy Center, either in Gulfport or in Diamond Head. Either way, you can definitely get some relief through the many different techniques that they have. Community Rehab Physical Therapy, Gulfport and Diamond Head.